It's Brittany Levy here from Stay Current, and this is an APSA article of interest that you should know. This article about the timing of pediatric tracheostomy after a traumatic injury was published in the Journal of Pediatric Critical Care Medicine in 2021. So the real question here is, when should we provide a tracheostomy for adolescent trauma victims following their traumatic injury? So how exactly do we figure that out? Well, the authors looked at the National Trauma Data Bank, where they could find over 40,000 adolescent trauma victims who were intubated for more than 24 hours and survived until discharge. So what did they find? Well, first, they broke it up into kids that had a TBI or a non-TBI, and they looked at both 3 and 7 days for a tracheostomy. So at 3 days, there was really no difference in overall hospital length of stay, but in kids that didn't have a TBI, they had a decreased ICU length of stay if they had a tracheostomy before 3 days, by about 16 days less than the ICU. That's a lot. Similar trends were seen for all children, regardless of TBI or non-TBI status, for if they received a tracheostomy before 7 days of intubation. So what do you do at your center? At what day do you start considering tracheostomy for the trauma victim in the adolescent patient population? Leave us a comment below.